The Honourable Member for Calgary Mountain View, followed by Calder.
Thanks very much, Mr. Speaker. Alberta Health Services continues to miss their own health benchmarks from 2010, including their first and second quarterly reports, 92 days late today. This cannot, of course, be blamed on the dedicated frontline professionals labouring to make this unwieldy system work. The government hides the reality that hospitals are dangerously over capacity, there are life-threatening delays in EMS response times, and there's a failure to achieve 8-hour ER admission targets. To the Minister, for 3 years you failed on your own benchmarks, 8-hour emergency in particular.
The Honourable Minister for a response.
Well, Mr. Speaker, I'm sure there's a question there somewhere. As I've said in response to previous questions, we are developing a new performance management framework for the healthcare system, Mr. Speaker. This is a joint effort on the part of Alberta Health Services in conjunction with their frontline providers, as well as the Department of Health. Mr. Speaker, we are actually, as I've said in response to previous questions, exceeding national benchmarks in areas such as hip and knee surgery, and at the same time we are serving growing numbers of Albertans, the highest growth rate in the country, Mr. Speaker.
Honourable Member.
So why are you not producing the second quarterly report, and why are you not engaging frontline professionals, experts, in setting these benchmarks, like Dr. Paul Parks?
Honourable Minister.
Well, Mr. Speaker, Mr. Speaker, as I've said in response to previous questions, we are developing a new performance measurement framework for the health system, one that looks at the performance of the healthcare system from the perspective of the patient, not the opposition, Mr. Speaker, not others who would seek to politicize healthcare issues. When that performance measurement framework is ready, Mr. Speaker, we will release it, along with results since the last quarterly report.
A simple question, Mr. Speaker. When can we expect the first and the second quarterly health reports?
Honourable Minister.
Mr. Speaker, that question was asked and answered. As to the honourable member's request in his previous question, his reference to working with frontline providers, he knows full well that we are, Mr. Speaker, that the focus of the healthcare system is to provide frontline people with the tools and the support that they need in order to deliver the quality of care that they expect to for patients. Thank you, Mr. Speaker.